is pulling damn teeth just to get a number of hospital beds in.
I told you.
Worst part of my day is updating this. 145,000 cases in the United States is now, in one day, 176,000. That went up 31,000 cases overnight. Number of deaths, 2616, now 3,431. Marion County, as of late last night, up to 23 cases. Over 100 tests still pending. So this number is going up fast, and that is a sad thing.
Pause real quick. You had 1,000 deaths overnight?
Yeah, almost 1,000 deaths overnight. Yep.
So whenever that happens in Italy, people freak out. But it happens in the US, it's nothing.
We have 350 million people, so the ratio isn't quite the same, but that daily increase of deaths and the daily increases of cases is how you know we're still exponentially increasing on our kind of total cases curve, right? And so what we want this to do is to start to go more like this in terms of daily cases, but we're not. We're still on this track straight up in the air right now. That's what's so scary. That's why we're mitigating. That's why we're working so hard at Trinity Clinic. So as we're gonna start every single video, we're gonna give updates for Marion County. So here they are. First, huge thank you to the community, to our viewers, the people that are showing us love and support, even some intel of what's happening in the community. We certainly appreciate everybody's good work. In fact, we have some homework for our viewers here today, a couple of different things that we're working on. Number one, if there's anybody that knows of any clinics in the Ocala or Marion County area that is doing COVID testing, please let us know. You can message us or call us on the main number. We'll put that main number up so people can call in if they have any advice on clinics that are doing testing. Another thing, homework. I want to go live to the local news, radio, newspaper, anybody that'll listen. So if any of our viewers know anybody that's in the media business, please get them our information and let them know what our efforts are so we can spread this word of mitigation and testing. The third thing, as always, Trinity Clinic is a PPE donation site. In fact, my sweetheart found this in the garage at our house last night. She posted a little video about it. These are N95 respirators that we had in our garage and we didn't even know it. I would ask anybody to maybe go have a peek in your garage or storage closet, whatever that it might be. Anything like respirators, if you're not using them or you don't need them, the medical community does and will need those things. So we're happy to receive them if you could be so generous to bring them to us. So that's it for homework for our viewers for this Tuesday. Updates now for the testing sites. Of course, Trinity Clinic, as always, is a testing site. We invite you to call if you're feeling unwell or know somebody that is and may need to be tested, and we'll talk about it. We did speak with Rainbow River Medical. They are doing drive-through testing, up to 100 tests a day is what we're hearing that they're doing over there. I believe they did 47 of them just yesterday. So excellent work, heroes over there in Dunellen, the west side of the county. Excellent work. The Villages testing site that I've talked about last week and the week before, that site is now closed. That was the UF Health COVID that we were tracking. A part of that was research, a part of that was actual tests. And that is now closed, so that will not be available for testing site at this point. We're still looking for facilities in the villages that may be doing testing so we can report that to everybody. So let us know if you know. And the last update here for today, just quickly, we talked about how we want to track Marion County's flatten the curve response curve. So we put a lot of work and effort into getting some answers into hospital beds and the capacity of the hospitals in our area. A number of people who've been watching have been giving us advice, guidance, doing research, as well as my staff. We're much closer today to having numbers than we were yesterday. Hopefully by tomorrow we'll have everything that we need to begin to build our Marion County response curve. Once we have all those numbers, we'll be able to track total hospital beds, the total number of cases, the capacity of our area and how many beds are full, how many beds are available, and we hope to even get ventilator information as well, so we know completely the number of ventilators. Still looking for hospital beds, still looking for number of ventilators. We hope to have that tomorrow. It was a good Tuesday. We got a lot done. We're going to continue working hard, and now roll the tape for what happened on Tuesday. Thank you. So up to 23 cases now in the county. As always, our stated goal is to keep that number as low as possible, but we already know there's a lot more people positive than that walking around, and we want to find those people. We're advertising testing. Come get tested if you're sick. Man, there's this thing that pissed me off last night. I was reading about this, right? Healthcare workers are starting to die in New York City now from COVID. Nurses and doctors are getting sick because of the environment that it's like in New York. This guy was young, healthy, a little older than me, dead. And then she told me about someone who posted this in Ocala word of mouth yesterday. Any nail salons open?
No.
This is not social distancing.
No.
Yeah, nobody has any nails right now. I want to use this as motivation to redouble our efforts to get this message out to the community. This is exactly the kind of thing that we want to stop. Right, Tatiana?
Yes.
Yes.
Yes. Yes.
Yes.
Yes.
Yes. So, oh, good morning. We were just talking about you.
That's okay.
But it was all good. It was all good. Here's what we're working on for this morning. Good morning. We were just talking about you. Ange, the village's testing site, I guess, is full. If you go to the website, you can't schedule anything. So, yeah, the ufhealthcovid.com. The reason I'm asking is we're getting calls from people that are in the villages wanting to be tested. And I'm thinking to myself, there's a test site right in the villages. So do they not know about it? Also, SK, you mentioned this. What we want to do is to try to compile a list of all the clinics in the area that are doing testing, as you know, just to start to get a running list. I know they're doing them right here next door.
Are they?
Yeah, they've done 3 already. Yeah, I talked to her this morning, so that's cool. So if we can just start to gather that list, that's not, I mean, I don't want somebody to get on the phone and make a call to every clinic in Ocala and ask if they're doing the testing, but the curve, flatten the curve. So this is the hospital bed work that we're doing. We want to try to find out how many total hospital beds that we have available. We've started to get some information from some viewers. That's cool. I texted a doc that I know, and he gave me some numbers this morning for ORMC in West Marion. I don't have any information about Advent at all, and we don't have a good contact. I don't want to keep, you know, bugging him every morning. So there must be somebody.
I called the main line this morning and I got the same response from yesterday. Someone will call you back from
Well, if you call ORMC, ask for Chad.
Chad.
There's probably more than one Chad that works at ORMC,
Yeah.
but there might be somebody named Chad. I don't even know the department.
There.
I need to talk to Chad.
Every Chad, get him on the
Bring
phone.
me all the Chads.
All the Chads. Okay, so that was the total number of hospital beds. I would love to know the total number of ventilators as well. And then we want a daily rough idea of the current number of admissions, so that'll give us how many empty beds that we have. He told me this morning that they're in good shape right now. So you can see by the elective procedures like these knee replacements and things that aren't being done, then people aren't using up hospital beds. Plus people are worried to go to the hospital, so they're maybe staying home when maybe they could have stayed home anyway and didn't need to go to the hospital. So that's the numbers I have, and he said he got those from Chad.
Okay, Chad.
So who's Chad? So we want to see if we can find somebody named Chad. And again, I don't have any info for Advent, so we need to find Advent.
Yeah.
Call us.
Please call us.
If anybody knows Chad at ORMC, have him call in.
5251200.
Yeah, put the number across the.
Right there.
Big news that we found yesterday, and you saw this in the video. Henry Schein
Yep.
has a finger stick IgG and IgM test kit. Mine's a drop off. We gotta sterilize all that stuff. It's covered in COVID. All these papers people are bringing in here, it's covered in COVID, right?
Yeah. Yeah, we'll definitely disinfect it.
Yeah, it is. Yeah, it is. Okay, so the Henry Schein finger stick IgG and IgM antibody test for COVID-19. Does anybody have a question about what IgG and IgM antibodies mean?
I honestly don't know.
I don't know either. I was hoping someone knew what it meant. You don't know what that means, do you?
You're so full of crap.
I'm full of
Crap.
Knowledge?
Knowledge, because you do know.
So the immune system makes antibodies to germs, viruses, and bacteria, and we can measure those antibodies. If the immune system has been exposed to something, the first antibody level that starts to rise is IgM. It's kind of more nonspecific to begin the process of battling the infection. That happens within a few days. Within about 2 weeks, the immune system starts to manufacture like the maintenance antibodies. That's IgG. So if someone was infected with something years ago, IgM levels will be low because it was a far past infection, but IgG levels remain, or IgG antibodies remain as kind of the memory of the immune system. So that's why when we get sick with something and, well, I've already had that, so I don't need to worry about that again.
Just say Epstein.
I was like, say like Epstein.
Yeah.
Like Epstein-Barr, when we measure IgG antibodies, and we can measure that for just about any infection that you can think of. So, but this is a novel virus, new virus. None of our immune systems have ever been exposed to this before, so we'll all get some kind of a new response, right? So that's what makes this one different. And then obviously we get sicker with this virus, which is why we're all worried. Yes, so if we can do a finger stick test, so that means I can tell if somebody was sick a few weeks ago and they had, well, how do I know if I had it? I can't swab them. They don't have virus anymore because their immune system beat it. But we can measure their blood and find out, yeah, you had it. I don't know when you had it. It might have been 2 or 3 or 4 weeks ago. So that is exceptionally useful, particularly for these negatives that we're getting up here. Like PUI number 4, I was like certain that she had it because she was so sick. You know, she had exposure. She works as a nurse in the ICU around confirmed positive cases, and she was seriously sick and it's negative, and I was like, wow. So I would love to do a finger stick antibody test on her just to sort of confirm the swab that we did, that she in fact was not exposed to it, or was the swab faulty. We need to know that kind of information as soon as possible. So burn Henry, shine up. I mean, listen to Germany, right? This is how you do it right. Germany, they're gonna mail people in their country hundreds of thousands of kits to do a home finger stick test looking for antibodies, and they mail it back in, and if they have antibodies, IgG antibodies, then they're kind of immune to the virus, is what we're assuming. We don't know that, but we assume that, and you get like a card, a certificate or something that you're allowed to leave the house, that I have immunity and I'm allowed to leave the house. They're mailing the citizens of Germany.
New York is like
Amazing.
that too. Your job is not closed down or anything, and you have to work.
Yeah.
If you get stopped by a police officer or anybody, like, you have to show them that.
Right.
To prove that you still have to work, and that's why you're.
That's the kind of thing that may be coming to a county near you. I don't want this county to have to lock down. You know, the governor just locked down Miami. Did you hear that yesterday? So finally, right, if the numbers continue to increase county by county by county, that's what's coming. But that could be 2, 3, 4 weeks from now before it sort of spreads and affects us to that level. We've already been locking down and sort of isolating for weeks already as it is. And so we're looking at another month or more of this. So we want to keep our cases as low as possible. That's our efforts. So if you could do this, let's get a press release written, a 1-sheet. We're going to release that to local media about our efforts to find as many test kits as possible to get to our county, and that's one thing we're working on, and our efforts to find as many positive cases as we can so we can get those people isolated and contact trace them and isolate all the people that go along with it. We're gathering supplies, PPE supplies for the anticipated need for hospitals, because the hospitals are the ones that are getting hit. Look, we have it easy. I mean, we're working hard, but we have it so easy. Hospitals all around the country, and it's only going to get worse by the day. Ugh, I can't even imagine. It's sad. We're spreading the word, right? We're spreading the word on the importance of mitigation. We need to do that by growing our audience in the community so we can spread the message about mitigation. With the goal, the singular goal that we have, that once we're through this whole thing, that Marion County ended up being one of the best counties in the country for, wow, what did they do so right down there? We want to be, just like I said at my whatever thing over the weekend, we want to be the heroes of our own story. We want the people of our county to be the heroes of our county. So if you can get that in a release and get that at the media. I hadn't heard from anybody. Still hadn't heard from anybody. Just to say, now that the whole team is here, everybody is rising to this occasion in an amazing way, all the way from the front into the back, and the things that we're doing in the parking lot, and the risk we're all assuming by inviting this virus into our life, and the good work by the clinic team that's operating every day to keep our patients and their needs met, while others of us are working hard to kind of battle this virus and spread the message in our community. So thank you, everybody. Good work. We're going to keep it up. Yep.
Thank you. Thank you.
All right, everybody. Wait. Terrible one. Terrible one. Again. I can't talk through these 8 face masks I'm wearing.
Can't breathe. Paramount Urgent Care in the Village is on the phone right now. They heard that we're doing testing from online. Testing site and everything. I don't know what's going on with that. So.
Sure. What? Oh, here?
With Megan. Yeah.
Oh, this is them?
Yep. Here, I'll put them on.
Hey, this is Dr. Kuhn. Yes. Yes. We do. We are testing, and they are welcome to call into our clinic. How many do you have that need to be tested? Do you know?
Do you want me to call her?
2? Sure, yeah, absolutely. We can accommodate them. I'm going to get you back on the line with one of the girls here. Let's see if we can get contact information if you like, or you can have them contact us, either way, and we should be able to get them swabbed in the next day or 2 if it's appropriate. We are doing all the testing for free. If somebody doesn't have insurance, we'll test them for free. If they have insurance and we don't accept it, we're doing it for free. We got to get testing done, right? Yeah, well, that's how we're doing it here. So we're happy to take anybody that you have at your clinic or any other clinics that you know. Let everybody know. Spread the word. We're doing testing. Excellent. I'm going to get you back on with Megan here. Hang on just a sec, okay?
You need my thing again?
Thank you. Okay, so that's a clinic, and we can get referrals from them, so we can get as many tests done as we can get done. So let's go get this swab done now first.
Hi,
How are you?
I'm okay.
Okay is not good enough. All right, so what we'll do, just to be safe, let's do a flu swab on you, and then if that's negative, we'll do a COVID swab on you as well. Good?
Sounds good.
All right, you're welcome. Hang tight. She's an LPN, so there may be some exposures there, and she's still working, so we would want to know for her, for sure, if there's a possibility that she might be spreading it to others within her facility. And she's younger, so her symptoms could be lighter.
Right.
So we want to test everybody we can. Department tracks this stuff every single day. I just need to get with him, or even just a message that it's okay to release that data. We have 35,000 local people growing who just want to know what our curve looks like. So again, all I'm asking for is just the number of hospital beds your hospital has. I just cannot get anybody to give me an answer on that. Is that making sense? It's not marketing.
Hey, that's mine. Don't throw that.
It is pulling damn teeth to get a number of hospital beds in.
Told you. Well, apparently whoever you keep transferring us to doesn't return phone calls, so I need to speak to somebody who does. And then here he came.
You know, the other doc that I spoke to that gave me the numbers for ORMC, he's like, this is public data.
It's not a secret.
So,
Yeah, and they're saying that they can't.
which hospital was I just talking to?
ORMC, West Marion.
Okay, so that's the numbers that I got from like a doctor buddy. He just gave me the numbers like, this is public data, sure, this is what I know. I just don't know for certain that that's correct. He's the one who said he's going to talk to Chad. Apparently Chad is the CEO of the hospital.
Oh.
So it's not Chad, and maybe it's Dr. Christian. Is it doctor?
They told me Chad Christensen, no doctor, no
Okay,
initials
so-
or anything.
So he's not the chief medical officer, he's the CEO then. So I mean, just a regular person in the admissions department would be fine. I don't need to bother, I know they're busy.
Yeah, and that's what I did.
And they want to transfer me to the marketing department.
That's who this
I'm not
is.
marketing for COVID, although I am marketing for testing, because I do want to do testing. So yes, we are marketing for that, advertise that. Doing testing. Okay.
DK.
Yes,
Hey, PUI number 7 called.
she's feeling good?
She's feeling better.
Yes.
Wants to know her results. I
Yeah.
have been checking the portal. Nothing. I think she was one of our first ones that we sent to LabCorp, which I hear they're like.
Oh, she's LabCorp. Okay, so she could be longer then.
Last I knew it was like 10 plus days.
10 plus days for LabCorp results. Yeah, because they're probably pretty backed up then.
Yeah.
So we still have no results for 4, 5, 6, and 7, which were done earlier last week. I'm sorry, 5, 6, and 7,
And 8.
and
I
8.
think 8 was too.
Yeah, 8 was too. So we're still waiting on results. Okay, I'm glad to hear she's better.
Do I have a letter?
All right, so just right here updating our PUI board resolution. We got in the third result yesterday. So our first 4 are negative, and numbers 5 through 11 are now pending. So we'll be waiting for those. Number 5, 6, and 7 should be coming in soon. So what we're going to do is get updates on the watch list. We're keeping track in the community for the PUIs, the people that have been tested here at Trinity Clinic on one side. And then on the other side, we have a running watch list. So these are people that we're tracking daily at a distance who haven't been tested, don't quite meet criteria for testing. They're sick, but we're not quite to the point that we feel that they need to be tested, but we're checking in on them every single day. We're up to 37 total people that we're currently tracking between people that we've tested and people that we're watching, and that number is growing daily, is it not?
Yep.
Okay,
Yes, it is.
can you give me updates for PUIs, just quickly, PUIs 5 through, well, however many you can give me, 5 through what, 9?
Yeah, because 11 got tested today.
Yep, 11 we just did.
So
Oh.
5 is better.
Better.
But they really want their results.
Improving, waiting for results, good.
6 is still really sick.
Okay.
And the blood pressure's up.
All right, so we'll keep close eye on him.
7 is still sick.
Okay, we'll keep close eye on her.
8 is feeling worse.
Feeling worse, okay.
9, no change.
No change.
10, much better, no more fevers.
10 is much better. Okay, so that's excellent. So there's still 3 or 4 then on that list that we're concerned that we may be getting positive COVID results. So we'll keep close eye on those. In general, how's the watch list going? Are people getting better, or are some people worsening? And we
I'd
may
say
need...
it's even on both sides.
On both, yeah. I say a lot of people feel the same. If not, it kind of just balances out.
Yeah, it varies.
Yeah.
It varies. Okay. But as of now, from this morning, our calls, and this afternoon, the watch list people, still nobody sick enough to bring in and get tested yet?
Correct.
Okay, so if there's a change of status on anybody on the watch list, get with me straight away so we can get them scheduled for testing.
Okay.
So that's how we're going to do it. We're going to continue to grow this watch list and grow the PUI list. This is how we're going to win in this county, is by finding every single person that's sick that we can possibly find, getting them tested if it's appropriate, and keeping close eye on them. Everybody isolated, spreading this message. Marion County is going to be the best damn county in the country.
Yes, it is.
Yes, sir.
Because of Trinity.
Well, I don't know about just because of us, because of all of our efforts. Thank you, thank you.
Are those the only 2 contact people, or Judy and Debbie?
Is that Advent? Hang up. I just got
Okay.
something. Okay, so I texted the chief medical officer at Advent,
Okay.
and he just got back to me a moment ago. So I was asking him about, I just need the hospital bed and the capacity availability. Hello, Dave. You can send that request to me, and I will make sure that our incident command center director sends it out every morning, and I have his email address. So we appreciate the chief medical officer at Advent for giving us that up-to-date information. We're working hard to get it, so good man. Let's talk about that.
Perfect. That's with Henry Schein. You got all your little pamphlets and stuff.
Okay, coronavirus.
That will get you 20 each of the IgG and the IgM
Okay,
finger sticks. It's a 15-minute negative or positive result.
And then the specificity and sensitivity on this is how good the test is. This is the way we say it in science. Specificity and sensitivity. After 10 days, 96% sensitivity and specificity. So this seems to be a pretty good test, particularly if they've had the virus in their body for a period of time. So we can get 20 of those?
Yep, I'm filling it out right now to send it back. You will get one of these, negative, positive. If it's a negative result, you turn around and you still have to do the nasal swab after to confirm.
Sure. How long before we can get those here?
They will start shipping. They're doing pre-orders now. They start shipping out on the 6th of April.
Monday.
Monday.
So they'll ship this coming Monday, so we should be able to get those next week.
Yep, and it's coming from...
All right, so we're going to be one of the first in the area then that has antibody tests, most likely. So that's going to be pretty awesome. We'll start small, make sure that this thing works, and then if it works, then we can always get more. We'll start with a kit, and we'll see what happens. Terrific. All right, so that's some good news. I needed some good news today. Thank you, Angela.
Oh, you're welcome.
Okay, awesome.
I'm really bad at holding things.
Roll tape.
Diarrhea. That's what I have.
Verbal diarrhea.
Verbal diarrhea.
Hey, somebody get her a bag for her verbal diarrhea.
Get ready to catch this.
Yeah, get ready to catch
I called
the
3 different OB offices so far,
an OB office
but
is
their
doing.
main like doctor's office, so not the OB portion.
Oh, okay,
They're like
yeah.
a branch off
I
of
gotcha,
it.
okay.
So they're doing the
So
testing.
so they're-
kind of just gave away that the kit is the same.
Or they didn't know
They
that.
didn't know that.
Okay, well, so you know what? Everybody
But-
can know. This is good information for any doctor's office to to know about. The LabCorp kit. This is the LabCorp one. It tests for viruses, which is what we're interested in. But this also happens to be the same swab for chlamydia. OBGYN offices, urologists may have these vials laying around. So we're going to see if we can track down more from some of the specialist office, but we need swabs too. I promise you that there are lots of these little vials laying around in doctor's offices all around Marion County. So anybody that works at a doctor's office in any doctor's office in Marion County, go look through your stash, especially if you're not doing testing, particularly if you're not doing testing, look through your stash and see if you have any of these vials. This is Quest. UTMRT
Transport tube.
is the LabCorp one, UTMRT, and the Quest one is the green top VCM medium. These are used for other kinds of infections and tests, so anybody that might have these at doctor's offices, track them down. If you're not using them, we'll find somebody that'll use them. So
We will use them.
yeah, well, or we will use them because we're testing everybody. Okay, so we need to figure out, or we need updates on testing sites and what the status is of that. So we know still the Ocala testing site's not operational because they don't have kits from the state yet. What happened with the Villages testing site?
ufhealthcovid.com. Their last day, the reason the website no longer works is because their last day was Friday.
Oh, they're not doing it anymore?
They only were doing it for a week to 10 days. I spoke to Quinn at the Villages Hospital, and I also spoke to Kayla. They transfer you to a number for telehealth.
Okay.
Kayla did advise me as of 10:35 a.m. They have 2 tents that are set up, one at the Leesburg Hospital and one at the Villages Hospital, but they are not currently testing yet, which was set up after the Villages Polo Club stopped. That's why the website no longer works.
Villages testing site is closed.
Right. That's why you get that error message.
Okay, well that explains that.
Right.
All right, so now who is doing testing then besides Trinity Clinic? We are doing testing.
Is doing testing.
Thank you. Who else?
Rainbow River
Right.
Medical.
Rainbow River. We heard about them last week. So what's the deal with them?
They are testing daily, actively, Monday through Friday, 7 a.m. to 3 p.m. No appointment needed.
Awesome.
You just drive up. You don't get out of your car.
Yep.
You just drive up. They, yesterday alone, did 47 tests.
Heroes.
The day before was closer to 100.
Rainbow River
Medical
Clinic.
20312 Robinson Road in Denellen.
Well done, Denellen. So they're testing a ton of people out there. Wonder where they're getting all their kits from.
That's a very good question.
That is a good question. Maybe when you talk to her later on, or let me know tomorrow or something, how they secured so many kits.
Okay.
Or did they already have tons of chlamydia kits laying around or something? You know what I mean? because that is something somebody might just have laying around and have had already ordered a bunch of them. Incredible. 100 a day. Boy, they must have a hell of a staff doing that too. So that is brilliant. Okay, good work, Rainbow River. So that's out the very west end of the county.
Yep.
Bravo. Over the coming days, if anybody knows or anybody is aware of medical facilities, clinics in the Ocala area that's doing testing, update us, message us, and let us know so we can get this out to everybody in the county. Our efforts will not be for nothing. You know, this is one of those things where if we do a good job with mitigation, this is interesting, if we do a good job with mitigation and we keep the number of positive tests low and we keep our hospitalizations low, and a couple of months from now when all this stuff is done, we're going to feel like this was all for nothing. All this isolating and distancing, because it won't have impacted us in our county, but that's how you know that we did an amazing job, is that places like New York, which you know somebody that's in New York that's getting hit hard right now.
I do.
Sad thing. All right. Brilliant work. I'm glad to have you back.
Why, thank you.
I'm gonna make sure that that's in the video, because this is how you get things done.
Hey, DK.
I didn't even hear
Megan's
it.
got something to tell you. So yesterday I went to the hardware store in the Shores, and he told me that if he gets any kind of masks or anything that we could use, he's not going to put it on the shelves. He'll just put it aside and give me a call.
Yeah, that's amazing. So we're gonna stockpile, so we have these kits available, or the PPE available for hospitals and clinics that are wanting to do testing and
And I left
can't.
my name in O'Reilly too, but they didn't have
Yeah,
anything.
auto stores.
Hey, tell everybody that this is a donation site for PPE.
This is a donation site for PPE. This
Me too.
is PPE. These are PPE. Anything that you may have that we can use.
But look at what these are starting to look like now, just. Huh?
Doesn't make, exactly,
Okay.
does not make sense.
We will test her, put her on for when? Tomorrow?
Tomorrow, 10 a.m.
morning, or have them.
But I don't know, like what, I just don't understand how she doesn't qualify for the swab. If
She's-
she's having every single,
Cough, fever, shortness of
diarrhea,
breath, diarrhea.
she said it's hurting. When
Headache.
she breathes, it hurts.
So she's too sick to even walk in their building, but not sick enough to be tested?
Correct. That's exact, yep,
What-
perfect way to put it. Perfect. Yeah,
We'll test her.
okay.
Thank you. Thank you.
Joe Angel called me back. Quest.
I can feel
Test kit.
I can feel the heat from your sunburn on me.
Joe Angel Quest. He called me back. He got in touch with his sales director. I explained the situation that we are actively testing every day. We need the kits to keep coming. So she pushed you up to the top 10 to get shipped out tomorrow. He will email me confirmation as
Yeah.
soon as it's shipped.
Like top 10 out of like our county, or like top 10 in the world?
Gajillion from Quest. I'm assuming it's a lot, and you just got pushed up to the top 10.
The top 10 in the world?
You are welcome. Air 5.
Ugh.
I can't.
Yeah, we got another Lysol bomb over here.
Yes.
So this is somebody that just dropped off some paperwork to us, and you're going through the full sterilization procedure. This is COVID lockdown in this building. No COVID virus survives here, not for long at least. We just need Kelsey.
Kelsey!
Kristen's up here. There she is. Good, I'm glad I have everybody here. Hey, come around, gather around me, because I want everybody to see this team. No, everybody just come over and get real close for just a second, but nobody breathe while we're doing that. And nobody touch each other. You know, we're getting a lot of support and a lot of help and a lot of advice and guidance and intel. Should we do a group thank you? Sorry. Who's gonna be in charge of the...
One.
Wait,
On three.
I don't know what we're gonna say. Or should we just all ad-lib our own thing and see what it sounds like?
On 3.
Okay.
1, 2, 3.
Thank you! No, that was great. I don't even think we need to do another one.